Hello and welcome back to Straumann Live in the Arena of Confidence at IDS. My name is Dr. Artemis Adkins, and for this session, I have the pleasure of welcoming Dr. Kris Chmielewski, Dr. Eirik Salvesen, and Dr. Orcan Yüksel to discuss their experiences as the early users of the new BLX implant system. Welcome, you guys. Thank you for joining me. So first thing I wanted to do, if it's okay, we would like to start by you introducing yourselves to the audience, starting with Dr. Kris, if you don't mind.
Hi, I'm a clinician. I work with implants from 1996. I am Master of Science in implantology, and from the last year I could experience working with BLX implant. So I will share my experience and some knowledge today, but for me it's very important to have reliable tools.
Very good. And Dr. Kris also is an ITI Fellow, a Master of Science in Oral Implantology, a visiting lecturer at Frankfurt University, a graduate of the Kois Center in Seattle, and the past president of the Polish Academy of Aesthetic Dentistry, member of the American Academy of Cosmetic Dentistry, and the educational director of the dentalphotomaster.com. dentalphotomaster.com.
Thank you.
I got it this time.
Thank you.
Okay, Eirik, let's start with you. Please introduce yourself to us.
Yeah, I'm Eirik Salvesen. I'm a periodontist from Norway, and I've been working in the implant business now for like 20 years. And I work with different systems, including Straumann, and I've been lucky enough to be involved in the early phases of the BLX rollout.
Yes. And I've had the pleasure of going and visiting this man in his clinic a couple of times this last year for this purpose. Thank you so much. So Dr. Eirik is also an ITI Fellow and international lecturer in periodontology and implant dentistry. And we're also proud to have him as a Straumann Advanced Education Center. And he started with the BLX system back in 2017, so he already has more than a year of experience with the system that we will ask him to share with us. So Dr. Orcan, please introduce yourself to the audience.
Yes, my name is Orcan Yüksel. I am a dentist working over 30 years in Frankfurt with my own clinic. Since that time, involved in many projects like education in university, in Frankfurt University, as well in the Luxembourg University with the master program. So, well, I'm involved a little bit in research with my own project, with my colleague Dr. Giesenhagen. We developed the bone rings. Probably you heard about that.
Yes.
Yeah.
Very nice. Thank you. And Dr. Yüksel is a graduate from Johann Wolfgang Goethe University in Frankfurt. He's also an alma mater of Istanbul University and a doctorate from Frankfurt University. He's been operating his own clinic since 1993 with an education center as well, and specialized in dental aesthetics and implant dentistry. As he mentioned, in collaboration with Dr. Giesenhagen, he is the inventor of the bone ring technique for vertical bone augmentation, which we will also talk about around implant systems. Welcome, gentlemen.
Thank you.
Okay, so why don't we start with Dr. Salvesen? May I call you Eirik?
Eirik is good.
So the BLX system was introduced in a very early stage to you.
Yes.
And I remember you being one of the first in human series of clinicians. This was already back in 2017, and I wanted to know, and if you could share with our audience, what was the convincing part that made you agree to participate in this amazing launch with us?
Well, first of all, it was a long-term and a long-standing cooperation with Straumann that, kind of the door opener of this, and it needed to be, because if you move into something new, you need somebody that you trust. But that said, I mean, after cooperating with Straumann for now 20 years, for the last 10 years you've been missing the implant design that I would like. I have to be honest about it, because I haven't been a big user of your older systems because they did not qualify according to my clinical protocols. And then when you introduced a very appealing implant design and you combine it with your strengths that you have on your surface and your material technology, that made me jump on board and say, okay, I want to try this, and the rest has been kind of a love story.
Ah.
Yeah, I like that one in a way.
Love story.
I'm sorry for that.
Okay. No, it's. Are you kidding me? I'm
No,
all
it's
love. Okay, thank you so much. We are very glad to have you on board with us. What about you, Dr. Yüksel? What was your convincing starting point with the BLX system?
Yeah, the first time when I had educational training on the implant system, I felt very confident by using this implant on a model.
Yes.
So what it means, the primary stability, the achievable primary stability is very easy to adjust. What is easy there? Normally we are drilling in the first side to the bone and looking, okay, the implant is getting too tight. So what we do, we unscrew the implant, drilling again in the osteoid with larger drill, and then later on try to screw the implant again, and hopefully we are not over exceeding the primary stability values about 50 Newton centimeter, and also not staying below 20, 25. But with this BLX, I felt I can adjust it by myself by unscrewing the implant and screwing it again. And that made me very confident to use it. And I said, I will, if I promise to a patient to make immediate restoration, I will never apologize. I'm sorry, I cannot handle it because you have a bad bone.
Yes.
Yeah, because at that time, it is everything in my hands.
Yes.
That's why I liked it. That was the door opener.
Very good. Thank you for sharing
Yes.
that. When I first started as part of the project team working with it, I described it to our team as the closest I felt to my hands being actually in the bone, the closest I felt that I had in the past. So I appreciate that. I agree.
Yeah.
Dr. Kris, what about you? What was your door opener to the BLX system?
I think that I had the same, let's say, approach that the majority of the clinicians who could touch and feel this implant, because when you touch and feel the properties, the features, how it behaves in the bone, you understand. Because we have plenty of implant designs, you can touch them, you can see the beautiful adverts, but this is not what makes the decision. You have to use it in a clinical way, you have to touch and feel to trust. And what I like very much, not only because of the primary stability of the design, I love immediate load. From the single tooth restoration to the full arch restoration. And this is what was missing actually in the portfolio of Straumann for a couple of last years, that it was not present somehow just to give this 100%, okay, we are on the good track. This is what we are looking for.
Agreed. Eirik.
Yeah.
I want to know, if I recall correctly, during the First in Human series, I remember you saying, wow, this is really self-cutting. I want you to comment to our audience who's watching, who are clinicians who may want to choose to experience this on the self-cutting properties.
I think the people that saw the video thought that I was kind of 95 years old, bending over and saying, oh, this felt cutting. But definitely, yeah, the implant, as a Straumann implant, this is a totally different story. So it is cutting, and it's and to me, the reason why I'm commenting it during surgery is that I'm so obsessed of having primary stability, has been taught, been spoken by my colleagues, and by that I always enter with a small osteotomy, and then we check out the conditions, and then we have an implant that will enter that osteotomy anyhow. Any size that might be. And with the earlier implants, in my opinion, from Straumann, it hasn't been able to do that in a predictable way. And with this implant, I could pass through the cortical bone with a small osteotomy, and even in hard bone. When we entered hard bone, we didn't have to tap, because we did what was said here. We adjusted the torque, and it feels gentle. And if I now compare it, if we talk about starting up with an implant system, and I compare this system to the other systems from Straumann, I'll say this one is more gentle.
Yes,
it's definitely more gentle, because it doesn't provide that pressure on the bone that I would say that more compact implant does. So to me, this has become what I would recommend as a brilliant implant system, even to start with, because of the confidence.
Agreed. Thank you so much. And I wanted to continue on the theme of primary stability with you, Orcan. What is an achievable, reliable primary stability, and why is it so important to you in a clinical setting?
Yes, actually you can achieve primary stability in any case by drilling a little bit less smaller the hole, and then we can squeeze the implant. But this is not what we want, because bone is a dynamic and living tissue, and if we squeeze, it will tank very much and disappear. So that's why what we do, we enlarge the bone. But when you cannot get the primary stability, your implant, especially by open healing procedures where you place the sulcus former on the top, is under a pressure, under the micro movement. And micro movement, as you know, is the worst thing what can happen to an implant.
Exactly.
Can, let's say, interrupt the osseointegration, and it will have fibrous integration. So that's why all our aim of the clinicians is to achieve the primary stability, not on the account of the losing the bone.
Yes.
So with, I think, this type of thread design, is my experience, we can achieve this reliable. What I mentioned also earlier when you asked me why it's important, what was the door opener? Yes, we are planning today for our patients immediate loading. We promise them, you can go out with new teeth. And then when I cannot achieve such a primary stability, I am losing my face. And all the time they apologize coming from our side, I can't do anything, that's your bone. But that's your implant. We are lucky that the patient doesn't know so much. Then they can say, then you have chosen the wrong implant. And that's given me the confidence to work with such a thread design. Yeah.
Agreed. We spoke with an earlier guest about the fact that, patients ultimately trust you.
Exactly.
They don't know how to judge materials and manufacturers. They trust you. And so I agree with you. It's nice to be able to use something that delivers on its promise. Speaking of delivering on its promise, Eirik, so primary stability, we've mentioned, immediate procedures are mainly associated with fully tapered implant systems. And Dr. George Raber, our head of product management, recently said in an interview that while we did not invent the fully tapered implant systems, we did aim to develop the most advanced implant system in this field. So this obviously creates very high expectations. So I want to know from you, in your opinion, having used this for long now, for over a year, does the BLX implant system deliver on its promise?
Well, it's a big promise to say that you have the world's most advanced implant system or fully tapered, but I think if we go back to the start of it, it's important to realize that fully tapered implants were not invented by Straumann. They've been around from different producers and different manufacturers, and it's just that now Straumann entered the area, but they didn't enter it kind of because they had to or a rush one. They designed, in my opinion, they designed an implant that seems to work with the concept that is thought to be in the clinic. They designed the components, all the things, the instrumentarium that we need, even from healing abutments up to permanent abutments. There's sleek design, there's refinements in it. These surgical instruments are better than they ever been. You finally have a pickup system of an implant that I've been missing for like 20 years. And so you did something really that made these systems, in my opinion, it's promising. I'll let Straumann still claim that it's the world's most advanced stuff, but I love it and I like it, and it's during the 15 months I've been working with it, it seems very promising. It has promising results even, so it's good.
Very good. Thank you for that. And Kris, you mentioned in a prior session that 100% of your implants are done with guided surgery. Obviously, the BLX implant system will have guided surgery capacity in June. I want to know if you will also be participating in that. You're one of the pilot users anyway, so if you don't mind, comment to our audience about this.
Actually, even if the BLX is still not guided, we did guided cases already with BLX, but we changed some protocols. We used the guided surgery kit from BLT system, so we just used the planning for BLT, but we inserted finally BLX implant. So it is just a partially guided protocol, because we make a fully guided osteotomy, but the implant placement is without the guide.
Yes,
you have to make it hand-driven. But honestly, the first impression when you are used to go fully guided and you are switching back to the manual placement of the implant, I had the impression in the moment of insertion of the implant that implant starts to guide me, because the thread design is very unique and different from anything what was present until now in Straumann portfolio. Yes. So somehow you have to be careful, especially in the cases of the immediate implantation, just to insert the implant in the right axis. Otherwise, it is the risk that your implant will guide you and change the position of the implant. Right. So we overcome these issues, and soon we will have as well guided surgical tray for BLX. Yes. And okay, I saw already how it looks. I could have this touch and feel, so it's beautifully. It's with a lot of improvements compared to the BLT guided surgical tray. So I cannot wait just to show you the cases with fully guided with BLX. And I think the future belongs to one of these implants soon. Yeah. I'm sure it will take a big part of the market. I'm sure about it.
Thank you.
You're welcome.
We like that you say that. Okay, Dr. Ercik, is guided surgery also relevant for you in your practice?
Yes, I love guided surgery. I'm using guided surgery frequently in my clinic over 15 years. I can't imagine not to use guided surgery in bigger cases, but no one is so perfect to place the implant in the right axis and position, etc. But more and more, the technique become common in dental offices, the CBCTs, etc. We are very close in all clinics to use guides, and I believe in a couple of years, it's not far away, people will not understand how we could place freehand implants.
Right.
Because every millimeter counts. Every millimeter must be before adjusted, and that can only be done with guides.
Yes, agreed.
Yeah.
It's like we used to ride horses, and then cars came, and then airplanes. Now I can't imagine riding a horse to visit you. Okay,
yeah.
Eric,
yeah.
For you, is guided surgery also relevant for you? I'm curious. Same question.
Most definitely, but We've been doing guided surgery since the launch of the novel guide system in 2005, which was a breakthrough for us. But it turned out that using the guide systems on totally edentulous cases was not as accurate as we were thinking at that time, yes. Because we were convinced that it was accurate, and it turns out not to be accurate in totally edentulous cases. So after that, we've explored this implant system, and to me it has been the logistics that will kind of limit the amount of guided surgery, just the logistics, because in a hectic private practice we work on a schedule, and by that we've seen that guided surgery has been a part of it, but not the complete story. Recently we introduced now the tree-shaped implant studio and the printer from the P20 series from Straumann, and now we are printing the guides in-house, which will then, as I see it, make more efficiency in that treatment. And we've also now recently introduced dynamic guidance with surgery. So guided surgery, yes, it's definitely there. I'd still just jump into the guided surgery discussion and say that I feel that everybody starting up with implant dentistry and implant surgery should do a lot of mentally guided surgery before they started doing guided surgery in itself, because they need to learn how to deal yes. with the clinical situation before you think that Absolutely. Whatever is of a guide will help you. So
yes. Agreed.
It's the biggest potential of mistake is still the clinician. It's still in the planning. It's still in everything. As Kris said, you do your drilling, and then you're going to insert your implant non-guided. You need to be aware of that one. So, yes. so you need to know the clinical situations. But yes. Definitely, guided surgery is good. We just need to make it effective. We need to make it seamless. It needs to be rolling as a normal day practice.
Agreed. I'm also curious about, as you guys probably can attest to this, at least when I was practicing up until last year, patients now more and more demand faster treatments, shorter time to their teeth, to their smile, and the technologies exist. The biology, the understanding of biology is permissive. So I want to know, in your opinion, is Straumann, with the new launches and the full breadth of products and solutions that we're offering, do you feel, from your perspective, with your experience with this company, that we are set up for the future to serve these patients?
Kris?
I am sure that with these approaches, with this knowledge which patients have,
Yes.
they want and they will demand from the dentist, I want to get immediate restoration.
Exactly.
I don't want to get with removable denture.
Exactly.
Can you provide
And
me
if you
this?
can't do it, I'll go down the street to my other... Yes.
Yeah. Immediately, if they will say no, they will look for other solutions. Because with social media, with all these activities, people know they can find. So it's not anymore, it's not possible for you.
Yes, agreed. Eirik?
But no, as long as we can do it with the same convincing success ratio that we have with traditional protocols, why not? Why are we not doing this for patients that would like to go without a removable prosthesis?
Yeah.
Why do we not try to limit the amount of surgery and the amount of times of doing surgeries? Of course we're working, and I think Straumann is now finally, again, moving into that field, in my opinion, which is so important. And I think now the challenge for Straumann is keep on developing the prosthetic components, because those will give these guys, with everything that they do, the ability to work with Straumann implants as long as we have the prosthetic components for all those indications.
Agreed. Thank you. Dr. Orcan, I'd like to hear your thoughts on patient demand, and is Straumann set up for the future?
Patients are always demanding nice teeth. They are not looking for surgeries or implant designs. So if we can fulfill this just by the first appointment, if we can promise to our patients acceptable solutions, they will agree with the treatment. Otherwise, they will postpone until nothing is left.
Right.
And then when there's nothing left, you know, how is that with the bone? We do not get the final result what we really want. So that's why for me it's important to have reliable solutions that I can say, look, we can do this for you. And patients are appreciating very much smart dentists. That's my experience.
And they're used to modern life now, right? They're gadgets. We've never been closer to
instant gratification.
The patient being completely knowledgeable about. Yep. You know, one of my colleagues used to have a sign at the entrance: "Don't mistake your Google search with my dental degree." But the reality is that people come in relatively well knowledgeable, well advised already by the time they come. So I agree that we bridge this gap better. Okay, Dr. Yüksel, going back to the implant system, as you know, this implant system didn't just go through with a new implant design, but it's the new pickup, as he mentioned, complete instrument portfolio, the prosthetic portfolio, the connection. There have been a lot of changes that have come from Straumann for this, the BLX system. Has this been a challenge for you and your teams in terms of training? Has it been a challenge for you to onboard?
Yes, of course. If you change something, what you have in your clinic, it's always a challenge because you have to learn the new components. On the other side, why I should stick with the old technology if there is something better available? Many implant companies are afraid to change because it's not only to change one single unit.
Right.
It's the registration process, catalogs everywhere, all around the world. It's a huge work for the R&D department, etc. So that's why implant companies want to keep what they have as soon as it runs good. But I think if Straumann go this way and want to change it, want to spend this effort, it's only just in our favorites, you know, in our behavior, I would say. We will use it. We will learn. What we have to do is change some screwdrivers, buy new ones. I think this is not a big deal.
Thank you so much.
Thank you.
Okay, now all of you guys are referral source clinicians. What's been your experience with other clinicians who may come with different implant system? How has it been for them to onboard onto the BLX implant in terms of the relationship? Has it been okay for you in your experiences, Dr. Kris?
In general, with referrals, it will be much easier for me right now with BLX if somebody wants to cooperate, because the prosthodontist who sends us case, I'm sorry to say, patient for the specific type of treatment, later on he has to cope with different sizes of the abutments, impression copings, etc. Now, especially with the new torque fit connection, where you have one connection fits all the implant diameters, it's much easier. It's more simplified. So I think for the regular clinicians, for general dentists, it's also the impact factor, the decision-making factor.
Very good.
No, I like the one connection thing, because it's, it simplifies everything. So just by having a referring dentist that hasn't used the system before, you will provide them with the necessary components of a scan body or impression post, and everything's done. That's the one thing. The other thing with this connection is that the touch and feel thing of this connection is quite different from other connections, because you will actually feel when the connection's in. So the engineering of this connection is, in my opinion, something that I really like, because on a model, on training, on touch and feel, when you do it, everything seems okay. But in the patient's mouth, there's soft tissue, there's always a little bit of bleeding, there's always a little bit down below the tissue. So and bone might be there, so everything, but with this connection, it really feels good.
It makes a difference.
Yeah. Yes, I completely agree. Dr. Orcan, we mentioned earlier that together with Dr. Giesenhagen, you were the co-inventor of the bone ring system. You have used this with the BLX. I would like to hear your experience with this.
Yes, I have to explain something. When in the beginning, we were using the autogenous bone rings, and always we enlarged the bone rings a little bit more just to avoid cracking of the bone. And then the primary stability of the ring by himself reduced. We were only focused on the recipient side's primary stability, which was achievable. But since we have a new implant, this implant must have 3.5 diameter size. Otherwise, with the larger diameters, it's a little bit weakening the allografts. And we changed using from the autogenous bone in the last years completely, almost 99% to allografts. Why? Because the clinical outcome after 8 months, I made a study on animals, and that shows after 8 months there is comparable bone remodeling, and there is no difference on bone implant contact and the bone volume. That's why we are using mostly the allografts. And with the allografts, you must be carefully, do not use a larger implant diameter. So that's why we are waiting until 3.5 is available in the market. And for sure with the thread design, which I like, we will get anyhow the primary stability. That's nice,
So on that note, gentlemen, thank you so much for sharing your experiences with the BLX implant system with our audience. It has been a pleasure to host you. I will see some of you actually later on as well. And in the meantime, coming to you live from IDS, auf Wiedersehen, I'll see you soon. Thank you so much.